Kitty, how are you today?
A bed, the most basic requirement for treating a hospital patient. Does England have enough of them? Not according to the British Medical Association, which calculates there are 15,000 fewer beds than 6 years ago. It's certainly a problem the boss of Colchester Hospital recognises.
If the whole system worked, if only people who were in hospital had to be in hospital, it was the only place they could be treated, then we would have enough beds. The problem is, of course, that that's not the case, that we know we admit people who don't need to be admitted for clinical reasons, and we have problems discharging people at the end of their acute phase.
It's when there are sudden increases in demand for beds that the lack of slack in the system really shows.
As we've seen this winter, surges in demand can start to overwhelm hospitals. To cope, they open wards of extra beds, but to staff them, they need to pay a premium to locum doctors and agency nurses, money that they haven't budgeted for. And that is how hospital costs start to spiral.
That unforeseen cost has opened up a yawning black hole in hospital finances. The target was for trusts to go no more than £580 million into the red this year. Now the forecast is they'll end this financial year £873 million in deficit. The Department of Health says compared to last year there are fewer trusts in the red and hospital performance is still among the best in the world. That's not the way doctors' leaders see it.
What we see is a system that is gradually and yet inexorably and horribly going off the rails for individual patients who find that they're not able to get what's promised in the NHS Constitution, comprehensive and universal care at the time they need it.
Patients may not know how short of beds their local hospital is and may not care how big its deficit has grown, but both provide worrying evidence of just how challenged our health service currently is.